So really, this device that we just implanted, primarily it's not a treatment. It's basically a monitoring device. So Micra, like pacemaker, that's actually a treatment for certain condition. This particular device's goal is to let us know when patients are going into heart failure before they reach a stage of where they need to now come to the emergency room or be admitted. So we can actually evaluate their pressures on a daily basis. It's all online. So they have this thing put in their lung, and it measures the pressures, and they go home and they have this pillow, they call it the pillow, and they lay on this pillow. It's basically full of electronics, records their lung pressures and sends them in. And we see them every morning. So we just review their pressures and see if their pressures are going up, call the patient, how are you feeling? Feeling okay? Well, you need to take some more of a certain medication so that it'll prevent them from coming in. This gentleman that I take care of, I've taken care of him for many years. Even just in the last 1 year, for example, in 2017, he was admitted to the hospital on 3 or 4 different occasions just for heart failure. Nice man, compliant with all his medications, takes them regularly, but not good with, they have to be very good about salt consumption. Salt is poison for them. And so he was getting readmitted often. Our goal with him is to catch his heart failure before it gets to the point where now he needs to be in the ER. And so with this, we can monitor him every day, and we can tell him, hey, you need to be careful with what you're doing, what you're eating. He's actually doing better already, because finally he's trying to be a little bit more compliant with what he does. And this will tell us if he's non-compliant, eating too much salt, we'll pick up on it because we'll know his pressures will go up. It's a simple procedure. It's all done from the leg. There's a big catheter that goes into we call it the femoral vein. So it's not an arterial procedure. It's the same as Micra, it's the femoral vein. And we go through the vein because the vein connects directly to the heart, to the right side of the heart. And the right side of the heart is connected to the lung. So what we do is go up. First we measure pressures. Then we go up with a very specific catheter that has this device on it. And we just thread that catheter all the way up into the lung. So what first we do is take a picture and find a good location of where we want to put it. So like this is a nice, good size location. This is in the lung. And we've taken picture from front on. That was the first picture. And then we take a picture from the side. So same picture, so we know the position. What we want to do is, if you can just imagine, we want to put it in a good sized vein that is towards the back, because the pillow that he's going to lay on, if he's a big person and this device is in the front, it won't pick up the pressures very well. So you want to position it so that it's back. And this is his back actually. And so this vein is towards the back and not towards the front. So we then once this thing, and we can look at it on X-ray. Do we have one that you can see? Oh, right there. Actually, right there is this little thingy here. Okay. And so once we have it in position, there is a little connection to this tube, and we pull that back. And what it does is it releases this device from the wire, and then it stays back. So these wires, these little thin wires, will make it stick into the lung vein. And once it's there, it should stay there. Actually, most of the work starts after that. It not work in the sense, but what we have to do then is correlate the pressures with what we are measuring, and they have a special device they put behind him, and they kind of correlate the pressures. And once they do that, now we can rely on those pressures. Actually, this patient went home same day.
Oh, really?
Yeah. About 4 hours after the procedure, we discharged him.